come from a cognitive behavioral therapy approach to trauma. So those of you who are trained in this know what that means, exposure protocols. There's an emphasis on working with exposure and healing trauma. So you could say the sort of underlying ethos or idea of this way of working is that the only way someone can recover from a fear-based disorder is to face their fears in a way that is healing. Do you treat trauma by exposing people to the fear? Or is that just going to re-traumatize them or make them worse or make them have a bad trip or get them into a fear state they can't come out of? Keep in mind, we're working with altered states. Or do you treat trauma by guiding and prompting people into resourcing and deepening into resourcing, and do you use the altered state to anchor that in or help them access it in a way that they haven't been able to before? I would say that the idea that these are opposite approaches is a little bit of a red herring or a false dichotomy. Because though these are frameworks that sound different, if you really look at what I am doing in the clinic, they probably don't look that different. I am doing exposure work with people on ketamine, and I am also helping them access resourcing. The reason is that when you are working with the altered state, there is an inherent healing wisdom to the altered state that actually knows how to heal trauma. Ketamine, or at least the client's psyche on ketamine, has a sort of inherent instinctual way of knowing what is needed. So you will see clients in these kind of situations toggling back and forth between leaning into exposure or leaning into resourcing. And if you are a good therapist, you always give them that choice or you help guide them through that choice point. But if you, for example, are steering a patient just to do exposure work on ketamine, something inside of them is going to want to lean into resourcing. And the opposite is true. If you take a client on ketamine and you deepen into resourcing almost exclusively, at some point there's a part of them that's going to want to walk into that wall of fire, right? Walk into that challenging place and see if they can confront it or experience it differently. And so what really happens is that the altered state itself knows how to guide people through trauma. And really what we are doing is acting as midwives to the process, right? And making sure that the person is kept safe physically, emotionally, and psychologically throughout the experience. And I have been doing this for many years, and we have never seen someone harmed or re-traumatized when this is done in a healthy way. So to the extent that there are reports out there that you shouldn't put people with trauma on ketamine, I would unfortunately have to say that the providers or the setting or that was being done in was probably wrong. There are ways to harm people, but if you know what you're doing, you absolutely don't. People will heal. And they will heal not because you are the most brilliant therapist on the planet. They will heal because the altered state is inherently healing. If the container around it, that includes the guidance, is done in the right way. So there's this really interesting dialogue around different forms of trauma therapy: somatic, exposure-based, resilience-based, or with emphasis on resourcing, all the ways in which therapists work with trauma in ordinary states of consciousness. All the existing, EMDR would be in this conversation, all the existing forms of trauma treatment that are out there, and there are multiple. And there are some people out in the community or in the blogosphere or, debating like which ones are best for working in psychedelic states. And what I would suggest is we actually don't have any data to talk about any better or worse treatments in the altered state. Yes, there are forms of trauma treatment under the cognitive behavioral therapy umbrellas that are more evidence-based. But keep in mind, those have been established by doing studies on many, 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 many people, but all of whom were in ordinary state of consciousness. We don't have data for what works best in altered state. Interestingly though, and this is the point that I kind of want to bring into the conversation, is that those of us who have experience working with psychedelics can tell the rest of you that it's not your job as a therapist to know the best evidence-based intervention in this setting. First of all, we don't have access to that yet. Those studies haven't been done. Altered state work is new. But what it is your job to understand is that the client, when they are altered, there is something in them that will know how to pace themselves, and will know if it is healthy for them to lean into an exposure or to lean into resourcing. And as a therapist, it's your job to track along with that. Track your client extremely carefully and have access to both of those ways of working. I will leave it there. But I wanted to put that out there as a response to some things that I've been hearing, and speaking from a place of real authority and experience in this work, finding out that wherever your entry point is into trauma work, if you respect the inherent wisdom of the client and their knowing of being able to sort of move back and forth between these two supposedly different ways of doing it, right? Exposure and resourcing, and having a respect for the fact that there's a third wisdom in the room when you are doing psychedelic work. And that is the inner knowing of the client when they are altered about what healing process is needed. It's almost like a natural unfolding that happens within them if you do the right thing with creating the container for it.